Ery-Tab, also known as erythromycin, is a medication used to treat a wide variety of bacterial infections and may also be used to prevent certain bacterial infections. It is classified as a macrolide antibiotic and works by stopping the growth of bacteria. It is important to note that Ery-Tab only treats or prevents bacterial infections and will not work for viral infections such as the common cold or flu. It is crucial to use this medication only when it is needed to prevent it from losing its effectiveness for future infections. As for the daily dosage, it is important to follow the instructions provided by your healthcare provider. The optimal timing for taking Ery-Tab can vary depending on the specific condition being treated, so it's best to consult with your healthcare provider for the best timing for your individual needs. When taking Ery-Tab, it's important to follow your doctor's instructions. It's best to take this medication on an empty stomach for better absorption, but if you experience nausea, you can take it with food or milk. Remember to swallow the medication whole and not crush, chew, or break it. The dosage and length of treatment will depend on your medical condition and how you respond to the medication. For children, the dosage is also based on their age and weight. To get the best results, take this antibiotic at the same times every day. This will help you remember to take it consistently. If you're using Ery-Tab to treat an infection, continue taking it until the full prescribed amount is finished, even if your symptoms improve before then. Stopping the medication too early can cause the infection to come back. Let your doctor know if your condition doesn't improve or gets worse. If you're taking this medication to prevent certain bacterial infections, make sure to follow your doctor's instructions exactly and do not stop taking the medication without their approval. Side effects of Ery-Tab may include nausea, vomiting, diarrhea, stomach pain, and loss of appetite. Taking this medication with food may help reduce these symptoms. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, it's crucial to tell your doctor immediately if you have any serious side effects, such as signs of liver disease, unusual tiredness, muscle weakness, trouble speaking, blurred vision, hearing loss, severe dizziness, fainting, or fast/irregular heartbeat. Ery-Tab may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal pain, or blood/mucus in your stool, contact your doctor right away. Do not use anti-diarrhea or opioid products in this case, as they may worsen your symptoms. Using this medication for prolonged periods may result in oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or any other new symptoms. While a severe allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada. Before taking Ery-Tab, make sure to tell your doctor or pharmacist if you are allergic to erythromycin or other similar antibiotics. Also, let them know about any other allergies you may have. It's important to discuss your medical history with them, especially if you have liver or kidney disease, or a certain type of muscle disease. Ery-Tab may affect the rhythm of your heart, so it's important to be aware of any symptoms of fast or irregular heartbeat, severe dizziness, or fainting. This risk may increase if you have certain medical conditions or are taking other drugs, so be sure to let your doctor know about all the medications you are taking. Low levels of potassium or magnesium in your blood may also increase the risk of heart rhythm problems. Be sure to talk to your doctor if you are using diuretics or if you have conditions such as severe sweating, diarrhea, or vomiting. Ery-Tab may also affect the effectiveness of live bacterial vaccines, so let your healthcare professional know if you are planning on having any immunizations. It's important to inform your doctor or dentist about all the products you use before having surgery. If you are on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, talk to your doctor or pharmacist because some Ery-Tab products may contain sodium. Older adults may be more sensitive to the side effects of Ery-Tab, especially hearing loss and heart rhythm problems. If you are pregnant or breastfeeding, consult your doctor before using Ery-Tab. It's important to be aware of any potential drug interactions that may occur with Ery-Tab. This medication can interact with other drugs, affecting how they work in your body. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. One of the drugs that may interact with Ery-Tab is digoxin. Additionally, there are many other medications that can affect the heart rhythm, such as amiodarone, dofetilide, and others. It's also important to note that other medications can affect the removal of Ery-Tab from your body, potentially impacting how it works. For example, azole antifungals, certain calcium channel blockers, and certain anti-seizure medications may interact with Ery-Tab. Ery-Tab can also slow down the removal of other drugs from your body, affecting how they work. This includes drugs to treat erectile dysfunction, certain statin drugs, and others. Lastly, it's important to be aware that Ery-Tab may interfere with certain lab tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Ery-Tab and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency medical help by calling 911. Otherwise, contacting a poison control center immediately is crucial for proper assistance. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. It's important not to share Ery-Tab with others. This medication is specifically prescribed for your current condition, so it's crucial not to save it for later use in case of another infection unless advised by your doctor. If you forget to take a dose of Ery-Tab, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Ery-Tab, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place other than the bathroom and out of reach of children and pets. If you no longer need Ery-Tab or it has expired, it's essential to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the best way to discard this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.